The all-on-4 treatment process is very different from dentures. I tell my patients they both look nice. You'll be able to smile with the denture, you'll be able to smile with the all-on-4. I have lots of patients who have been in dentures for many years, and then they go to the all-on-X procedure, and they are just completely amazed at the difference. I had a patient describe to me the next day he sat with a bowl of applesauce for a whole hour because for the first time in 20 years, he was able to taste the food. All-on-4, all-on-6, all-on-8, it's describing a process. So it doesn't mean we're only placing 4 implants or only 6 implants. We place as many as you need to replace all of your teeth. A good candidate is someone who is generally healthy. There are certain contraindications for dental implants, specifically people who may have uncontrolled diabetes. So we would want to work with your medical doctor to make sure that you're medically able to undergo the surgery. Someone who's a good candidate for all-on-4 implants would be someone with enough bone to support implants. But if you don't have enough bone, that doesn't mean that you're not a good candidate. It just means that we have to do a little bit more work to rebuild and replace the bone before we can place the dental implants. The treatment process for dental implants begins with the end in mind. We start with your smile design. We want to know what you're looking for in your smile. So sometimes I ask patients to bring in photos. Maybe they're old photos of what you looked like before when you had teeth, or maybe they're inspiration photos, someone's smile that you like. So we'll start with that. We'll decide what you want your final smile to look like. Once all of the digital planning is done, we'll bring you in for a pre-surgical consultation where you're going to sit with me and we're going to go over everything. You're going to sleep for most of the procedure, but if I say, Mrs. Jones, can you move your head to the right? You'll wake up. If I tap on you hard enough, you'll move to the right and then you'll go back to sleep. So it's a comfortable procedure. A lot of patients don't remember all of the surgical procedure with the sedation. After the surgery is done, you're going to leave out with your new teeth. And this is the fun part. This is where you wake up and you have your new smile. Many patients ask me, is this going to hurt? How long am I going to be out? Am I going to be able to return to work after surgery? And most of my patients are surprised when they come in the next day and they're feeling pretty good. A lot of patients come in and they're concerned about, will my teeth look natural? They want to make sure that their teeth look like their teeth and not someone else's. And that's what I mean when I say that we really do start with the end in mind. So we're going to work with you to make sure we know what your idea is when you're thinking about your ultimate smile. And again, we'll take pictures, maybe old photos of your old smile, maybe inspiration photos of another smile that you really like. But we're going to work with you to make sure that we know the end result. We pride ourselves in paying good attention to detail and listening to our patients because not everybody's looking for the same smile. Some patients want the Hollywood smile, some patients want a gap, some patients want gold, and we can customize based on what our patients are looking for.